Let's go over some different types of sudden illness. We've already talked about some of them. We talked about heart attacks when we talked about AEDs and CPR. But we haven't really talked a lot about stroke. So that's more of a brain attack. Either a clot stops blood supply to the brain, or they have some sort of hemorrhage, aneurysm that shuts down oxygen to the brain, and that area of the brain dies. But sudden illness is not just stroke. You can have things like asthma, fainting, seizure, diabetic, emergencies. There's a lot to it. We're just going to focus on some of the major ones. So stroke, you have interruption of blood flow to the brain. Ischemic strokes account for 80-85% of most strokes that happen. You have TIAs, which are transient ischemic attacks, which are what most people are referring to when they talk about mini strokes. So instead of the clot going through like in a standard ischemic attack and it just sticking and staying, in TIAs they stick and then they move on. So they don't stay there long enough to cause too much permanent damage. In most cases, it's not permanent. So hemorrhagic strokes are what we're talking about when you hear about somebody having an aneurysm. So the aneurysm is actually the ballooning of the vessel. But when that ruptures, a person can have a hemorrhagic stroke. So people are more likely to die if they have a hemorrhagic stroke because the vessel is damaged, it bleeds out, it causes further bleeding in the brain, and then those brain cells don't get oxygen and the brain is damaged. And like we've repeated throughout this course, the brain can only go about 4 to 6 minutes without oxygen before it's permanently damaged. So care for stroke, what do we do? Now you'll notice here I've got call 911 first, but really you should use the mnemonic think fast. So it stands for face, arm, speech, and time. So if you think somebody's having a stroke, you want to look at their face and see if you notice any paralysis. So you can ask them to smile and see if you see any drooping on one side of the body. And then have them raise their arms. If you see drooping on the same side, that's another indication. It's another key that allows you to see if somebody's having a stroke, or at least you're looking for symptoms. Have them say something that they would know, like, what's your name? If they can't remember what their name is or their speech is really slurred, it's another key indicator that they're having a stroke. And the T stands for time, and that really represents two things. You need to note the time that the symptoms started to happen, and it's time to call 911. So you may read in some literature where they have call 911 first, but think fast. Using that mnemonic, you can do it so quickly, you're not really delaying too much on time. And it gives you a lot of information that you can pass on to 911. So you don't want to give them anything to eat or drink because they could have throat paralysis, and that could cause them to choke and shut down respiration. You want to see if they're taking any kind of medications. Do they have any kind of blood pressure medications? And they're always going to have to seek advanced medical care for any type of stroke because it could be a larger issue. It could reoccur. That clot could go on and block another area of the brain. Even if it moves like it's a transient ischemic attack, it could cause further damage. And so they need to get on some clot busting drugs. And so there's a lot of things that can happen. If it's an aneurysm and they've had a hemorrhagic stroke, obviously they have to go in and have surgery to repair that area. And they could have brain swelling that occurs that could cause further bleeding to occur in the brain. Because what happens is, as that blood builds up, it starts to press down on the brain because it has nowhere else to go. And it causes other vessels to get severed. And then that causes more bleeding, which causes more swelling and more blood loss internally. And then the problem just goes out of control. Watch this video, answer the questions on your lecture notes. So asthma, chronic lung disease, have inflammation of the airway, a lot of mucus production. The highest prevalence are people between 5 and 17 years old. You may have heard of people growing out of their asthma. Some people are only exercise-induced asthma. Some it's aggravated by the cold. Some people have it, anything could cue it up. But the highest prevalence is 5 to 17. I see this a lot in exercise classes, especially if people go outside and work out and they're not used to it. They may not even know they have asthma or exercise-induced asthma until they get into that cold air. They start to breathe it in, it aggravates the airway. Ozone can do it. Allergies can cause asthma to kick in. So signs are coughing, wheezing, shortness of breath. So how do we care for it? Put them in a comfortable upright position so they can keep that airway open. Make it easy for them to breathe. If it's a known condition, hopefully they have their rescue inhaler with them. So you give them 2 puffs and you should see a response fairly quickly. So if they're having a mild asthma attack, 2 puffs, evaluate their condition every 15 minutes. If it doesn't get any better, another 2 puffs. If it doesn't get better within 30 minutes, then call the physician. If it's severe or they can't even carry on a conversation and the medication doesn't help, call 911. Keep giving them 2 puffs of the rescue inhaler every 15 minutes until the EMTs arrive, and don't exceed the recommended dosage. So make sure you read on there and make sure you don't go over the recommended dosage. Seizure. This happens a lot. I see it a lot, at least once a semester on campus. So what's happening, you have a short circuit in the brain, normally close to where the corpus callosum allows the 2 hemispheres of the brain to communicate. So individuals may have a single seizure. People with epilepsy, it's a permanent condition. They may have repeated seizures. You may have an individual that has a non-convulsive seizure where they just kind of zone out, stare off into space. And then you may have the more traditional convulsive seizures that are obvious that you'll see, and they may be repeated. So care for seizure, clear the area so they don't hit something and hurt themselves. You can pad the head so you can put something underneath it. You can move them over into the rescue position so that their tongue doesn't fall back. They're not going to choke on their tongue. The tongue is attached. It's not going to, they can't swallow their tongue. But it can fall back and relax if they're laying flat on their back and make it tough for them to breathe or even block the airway. So the rescue position's good, helps keep the airway open. And in that way, if they vomit, they're not going to aspirate on the vomit. Look for a medical ID. So when do you call 911? If they've never had a seizure before, so they come back around, you're like, hey, have you ever had a seizure before? And they're like, no. Something else may be causing it, so call 911. If they injured themselves during the process of the seizure, so maybe they just fell out and hit their head really hard on the ground, that's the time to call 911. If they have repeated seizures, so they come back around and then they have another seizure, call 911. If it happens in or around water, you may not have known it, maybe you didn't observe it happen, but they could have breathed in some water, and that could cause another condition, pneumonia-like symptoms, even if they get that water out of the lungs. So you still want to call 911 if it lasts more than 2 minutes. So you'll see different literature. Some say 5, some say 3, but I've seen as low as 2. Always go with the lowest number that you read about in different literature. So if it lasts more than 2 minutes, it's time to call 911. Diabetic emergencies. These are fairly common, especially for people that exercise. They'll end up using up a lot of their glucose and have at least hypoglycemic conditions. So type 1, body doesn't produce insulin at all. So they have to have injections, or maybe they have a pump, but they have to have an external source of insulin. Type 2, cells are insulin resistant. That's one type. Or a limited amount of insulin is produced. by the pancreas. So you may also see people that are experiencing hypoglycemia, so low glucose, low blood sugar. Body's using it up. That's a diabetic emergency. So it normally has a sudden onset. So they may get the weak trembles, start to shake, get real sweaty, may not even be able to make sense because not enough glucose is getting to their brain. Our brains run off blood sugar. Or hyperglycemia, where too much blood sugar is out there. So it's a gradual onset. Happens a little slower. And so fats start being used as fuel. Ketone levels in the body build up. Can be dangerous. They can go into a diabetic coma with hypo or hyper. And it can be tough to tell what's going on. So here's the general care that most experts in the field agree upon. So ask them if they've eaten anything. If you're still uncertain or the person is kind of going in and out of consciousness, where they're not making a lot of sense, as long as they're conscious, you can give them 15 grams of sugar. So what is 15 grams of sugar? That's about a quarter of a Coke, or if you have an 8-ounce glass of juice, especially orange juice, because that's fructose and it gets in the system really fast. So giving them about half a glass to a quarter of a glass would be roughly 15 grams. So if they are hypoglycemic, you should see an immediate change. They should come back around. That blood sugar gets out there, they start feeling better, they start acting normal. If it's hyperglycemia, the 15 grams is not enough to make their condition worse, but it is enough to tell, okay, now I know it's not hypo because their condition didn't change. We know that they have a known diabetic condition. It's probably hyper. For some reason, the cells are not uptaking the glucose, and so it's still in the bloodstream, and that's what's causing the problem. So that's how we care, and that's how we determine what's going on. If it's hyper, and you have no way of giving them insulin, or they're unconscious and you can't give them any sugar, you definitely want to call 911 as soon as possible. So watch this video, answer the questions on your discussion notes. So here's the skill that we'll do in class, pretty easy one. Face, arm, speech, time. Once you determine or think or you suspect somebody's having a stroke, then you call 911.